Hello, my name is Dr. Andre Jones, and today I wanted to talk about a topic that a lot of people don't know a lot about, and that's something that's called sedation dentistry. Sedation dentistry came about because, as most of us know, so the dentistry is not the most comfortable thing that we can experience in our lives. So we're always trying to seek out what ways that we can help facilitate or make dentistry more comfortable for somebody. So if you will tune in with me, we'll be answering a lot of those questions today. So a question that is very commonly asked to me is, what is sedation? So sedation is where we use a medication, either in the form of a gas, pill, or injectable, that helps someone just calm and feel more relaxed. And there are different levels to sedation, and then really the levels are just based on like how relaxed we need this person to be, and that way they are comfortable to get to go through the dentistry that they're going to be experiencing. So a lot of us in dentistry have not had the best experiences, or we hear horror stories and all these things, and that just gives us a lot of anxiety. And so sedation dentistry is the perfect solution in treating something such as anxiety. And the reason for that is because it helps calm down the receptors in our brain that are just sending out the hormones for anxiety that just make our heart rate go up and just make us anxious and worried and fearful. And it helps calm all that down. And like I said, people have different levels of anxiety. And so what's awesome about the type of sedation dentistry that we do is that we have levels for every single place of anxiety. And that way we can make sure that people are comfortable to get through what they need in order to get healthy. So there are 4 different levels to sedation in dentistry. We have 1, 2, 3, and 4. So the first level of sedation is just very minimal level of sedation. It's where we use something like nitrous or use a pill to help just kind of calm the person. They are fully awake, but they're in this place of just feeling very relaxed. And maybe if you had a bad night's sleep, you might fall asleep, but the intention or purpose of the medication is not to put you to sleep, but just helping you feel relaxed and kind of take the edge off. I like to often compare it to is like maybe having like a couple of drinks of alcohol where the edge has been taken off and you're just feeling that you're in that state of relaxation, but you're fully aware, fully cognizant of what's going on around you. The second level of dentistry is also at a similar level, maybe a little bit deeper, but it's where we can combine more than one different type of medication together in order to get you to that place of relaxation and kind of that place of just a calmness and rest. Level 3 is where we take it up a big notch. And level 3 is where we are now sedating a person to fall asleep. Oftentimes, level 3 is done through an IV, and this is what's called moderate sedation. And so at moderate sedation, we want a person to fall asleep because oftentimes just either being awake through the procedure would just be either too traumatic, would be very just uncomfortable, or they have such a level of anxiety where they just don't want to be aware, they want to be asleep. Now, at this level of sedation, this person is still able to respond. So although they are asleep, we like to say kind of like they're in a twilight where you're asleep, but if I call out your name loudly or if I, tap you on the arm, you're able to kind of just gradually kind of like just gradually wake up, respond, but you're going to fall immediately back to sleep as soon as the instructions or the question that has been asked has been completed. And the reason why this is really beneficial for us is that we're, in dentistry, we're working in your mouth, and sometimes we might need you to open up a little bit bigger or turn to your right or turn to your left. And this helps us still able to accomplish those things without having to physically maneuver you. Now, level 4 dentistry is where someone is completely asleep. They're under what's called deep sedation or general anesthesia. And this is where they are completely asleep in this deep state where they cannot be woken up. Or it would take an immense amount of effort to get them awake, but they can't even stay awake, even as hard as you try. And again, we go to that level because sometimes we have people who have just such severe levels of anxiety that any type of stimulus, any type of awareness would just make it not doable for them to receive the type of dentistry they need. Or in our practice, we work with a lot of individuals with special needs. And for a lot of those special individuals, we need to have a way to facilitate their care. And the only way that we can is if they are completely asleep. And so that's what the different levels of sedation dentistry are in a nutshell. If you'd like more information, feel free to call our office at 210-734-5092. to learn more about sedation dentistry. Look forward to hearing from you. Take care.